Hi everyone, welcome back to my YouTube channel. Today we are going to talk about ovulation induction drugs. Let's start our topic with introduction. Ovulation induction is a medical treatment used to stimulate the ovaries to produce and release eggs. It is commonly prescribed for women who have irregular ovulation or anovulation, that is, lack of ovulation, which accounts for about 25% of infertility cases. Ovulation induction drugs, often referred to as the fertility drugs, help regulate ovulation, improve the uterine lining, and increase the chances of conception. Types of ovulation induction drugs include clomipene citrate, that is also called as clomid, letrozole, gonadotrophins like follicle stimulating hormone and luteinizing hormone injection, human chorionic gonadotrophins, and gonadotrophin releasing hormone agonist and antagonist. Types of ovulation induction drugs. First is clomipene citrate, that is synthetic ovulation stimulant. It works by blocking estrogen receptors in the brain, leading to increased release of follicle stimulating hormone and luteinizing hormone. It is often the first line treatment for women with ovulatory dysfunction. Second type of ovulation induction drug is letrozole, that is aromatase inhibitor that reduce estrogen production. It stimulates the release of follicle stimulating hormone and luteinizing hormone promoting ovulation. It is increasingly used as an alternative to clomipene, especially in women with PCOS. Third type of ovulation induction drug is gonadotrophins like follicle stimulating hormone and luteinizing hormone injections. They directly stimulate the ovaries to produce multiple follicles. They are used when oral medications are ineffective, and it requires close monitoring to avoid complications like ovarian hyperstimulation syndrome. Fourth type of ovulation induction drug is human chorionic gonadotrophin, that is administered to trigger ovulation once follicles are mature. They mimic the natural luteinizing hormone surge. Fifth type of ovulation induction drug is gonadotrophin releasing hormone agonist and antagonist. They are used in assisted reproductive techniques such as IVF. They help control timing of ovulation and prevent premature release of eggs. Indications. Ovulation induction drugs are prescribed for women with irregular or absent ovulation, with unexplained infertility, in preparation for assisted reproductive technologies, and with women with hormonal imbalances affecting ovulation. Side effects. Potential side effects vary depending on the drug, but may include hot flashes, mood swings and headaches, fatigue and dizziness, multiple pregnancies, ovarian hyperstimulation syndrome with gonadotrophin, and abdominal bloating and discomfort. Successes. Clomipene citrate induced ovulation in about 70 to 80% of women, with pregnancy rates about 30 to 40%. Letrozole shows similar or slightly higher success rate in women with PCOS, and gonadotrophin are highly effective but carry high risk and costs. Monitoring. Close monitoring is essential to ensure safety and effectiveness. Ultrasound scans to track follicle development, and blood tests are done to measure hormone level. Adjustment in dosage is done to prevent complications. Conclusion of this lecture video. Ovulation induction drugs play a vital role in treating infertility caused by ovulatory dysfunction. Clomipene citrate and letrozole are common first-line treatments, while gonadotrophins are advanced hormonal therapy that are used in complex cases or assisted reproductive techniques. Though highly effective, these drugs require careful monitoring to minimize risks such as multiple pregnancies and OHSS, that is ovarian hypersensitivity syndrome. And early diagnosis and individualized treatment plans significantly improve fertility outcomes. And this was all about ovulation induction drugs. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.